Welcome everyone to this session on telebehavioral health 102, so next level up for those who may have participated in the last session. My name is Danielle Lauder and I'm the director of the Northeast Telehealth Resource Center. And I have the pleasure of introducing today's breakout speaker. Some of you may already have met him in the last session or through other work with Mid-Atlantic Telehealth Resource Center. Jay Ostrowski is the CEO of Behavioral Health Innovation, where he develops and deploys telemental health, telebehavioral health, and tele-MAT programs and designs HIPAA-secure software apps such as adaptive telehealth. He also serves as a telehealth consultative and implementation partner for the Mid-Atlantic Telehealth Resource Center. And I will say also, he has provided us with a fair amount of guidance and assistance with our stakeholders within the Northeast Telehealth Resource Center. We've known him for several years now and have had the pleasure of getting to know him and really passionate about developing technology and tools that help really establish great care for telebehavioral health specifically. So in keeping with our short introductions so that we can give the time to our experts, I'm going to go ahead and turn it over to Jay. Thank you so much for being here with us. Oh, and just a quick reminder, guys, if you can put your questions in the Q&A on the app, I'll remind you via the chat. It's easier for us to manage them that way. Much appreciated. But if you do end up putting them in the chat, I'll switch them over. So thank you for joining us, and thank you, Jay. Take it away.
Thank you, Danielle. It's a pleasure to be here again. And if you didn't get to see our first presentation, we will have that recorded and available to you. This is going to be a slower down version than the first one. You're probably grateful for that. And a little bit more hands-on practical, because we want to go through some things that aren't normally on our webinars that might be really helpful to you, and a little bit of variety as well. So for those of you that are new, we have some resources that we'll be sharing with you. We have created quite a lot for all the TRCs, and there are experts across the country that can help you. And I guess I just want to first encourage you that if you're needing to do these services, or you've already been doing them and you're really concerned, we can give you lots of reassurance and lots of guidance to help you. And we have quite a few resources on our websites, and I know they've given out links already, and there are more to come. And then if you can't find the resources on the site, you can contact us through our contact us forms, and we're happy to share those with you to help you get started, because we are passionate about helping people get help. We believe that everybody really should have access to good health care. And we've seen Danielle's group and our group, we've seen people get help in ways that they couldn't any other way. So we're pretty excited on empowering a whole lot of new providers to do this. But we understand that it's new, and new can be nervous. Ironically, I'm a licensed professional counselor and supervisor, and I don't like change either, especially change forced upon me. So I think we can give you some guidance and help to do that. And I hope this is helpful to you. And again, as we're going, feel free to go ahead and ask questions as you go along. And then by the time we get to the end, we'll have some time for Q&A, and we'll have ready to go to rapid fire answer those questions for you, because we know we want to be very personal. Obviously, COVID has done a number on our healthcare system, as you guys know, and so there's quite a lot that's changed in how we deliver care. But I will say that we've been incubating these things for quite a long time. So while it might be new to you, it's not necessarily new. I've been introduced as that guy that's doing the new thing telehealth, or the new thing telebehavioral health. And while I work across the whole spectrum of healthcare, telebehavioral health is my passion. We've been doing quite a lot of this in the US for 50-something years, and in different slices of it. And we've talked in the last sessions about the different components of this that can be used. You might be brand new to this and go, well, I just don't know how to even do a video session. And maybe your company is starting this and you need to do that. We have guidance for you and help for you. If you have been doing this for a while, I just want to make sure you're doing it safely and effectively and ethically, legally. We have resources for you too. And if you've kind of been there, done that, and wonder if you're going to get any value from this session, we're going to talk even more granular details and actually some other ways to think about how you deliver care. So I don't know about you, but in my practice, I offered lots of other things instead of just individual one-on-one sessions and group sessions. I would want my clients to be working on their issues in between sessions. So even if you're a psychiatrist or a nurse practitioner or a counselor, usually you want them doing some work. So we have different things to think about and ways we can do that through different apps and technologies. But telemedicine solves quite a lot of problems. And I'd like you to be thinking about what problems it can solve. But I also want you to be thinking about not just the video itself, but the technology that we use around this. A lot of us have technology that we've been using, but we haven't been using it with our patients or using it as effectively, or maybe we're using the insecure, wrong things. And it's time for us to kind of level up, if you will, to things that are more secure. There are quite a lot of different items on the market, software on the market. We make one, but there are many other good ones out there. We have a comparison site that's embedded in the Matrix website that helps you shop for those by criteria. It's the Telemental Health Comparisons. And that will help you kind of identify by criteria what fits in that, what you need. And maybe you don't need to give up on your normal software you use, but maybe you need to add a layer of something where you can have a patient portal and have engagement with your clients. Some of you already have those and maybe just been underused, and it's time to kind of use them again. But some of the problems that can be solved is really on the clinical side, is that you can collect a lot more data from them and basically measure better outcomes. It's a lot easier than handing them something in person. It's because that's kind of an awkward workflow, right? But if you have them fill out a survey before every session, that can give you quite a lot of good data of how a session's going. And then right after, you can force a survey of, fill this in, how did the session go? It could be 1 or 2 questions. It could just be a thumbs up, thumbs down, and maybe even another question there. But it's time that you get more information to see how you're doing as a practitioner, and maybe not just how you're doing on video, but how you're doing in general, so that you can make sure that you're really hitting the mark with your clients. Because the more you are, the more you'll get, more clients, and you'll be satisfied with your work when you know you're doing great work. And if you're not doing great work, it's time and you do something about it, right? So just again, getting more information, also getting more clinical information up front. Some people have their clients fill in like a PHQ-9 or a GAD-7, one of these surveys that kind of give them some information. That can be done kind of forced through a registration process with new clients, or forced every session before they join a session. So think about gathering more information through your software, through your systems, so that you can do even better work with these people that have this limited time on video. But of course, video itself provides quite a lot of options, because this is somebody that doesn't have to go get care. They can do this through video. And we have a lot of systems that are available that are low bandwidth, where you can do this even as low as 300 KB, which is like a little fraction, but have reasonable video encounters with them. The frame rate's a little bit lower, but you're able to do a good encounter that way. So for people in the mountains, people in rural areas, sometimes that's all they have. And that doesn't mean if they don't have broadband they can't do it. It just means it's a little more cumbersome, and we need to be mindful that we might need a software that can handle that. So there are quite a few out there that have that ability. So some of the other problems that it solves are just the access in general, access to experts. So maybe you're a counselor, but you need a psychiatrist to do med management, or a nurse practitioner or something like that. Being able to coordinate care, the technology, we can use it to coordinate care. Also apps in between sessions, we can gather data on how they're doing on a daily basis by pushing little notifications to say, how am I doing? Or if they're having some episode, whatever that might be, they can, put in some indicators to tell how they're doing, what they're doing about it, what's working, what's not working. So that by the time you have a session, you can have this data. So there are lots of different apps out there. Some are secure, some are not secure. It really depends on the apps. And if you want to contact me to talk more about apps, I'm happy to do that. There's also some comparison website information on our website for you on that. But I would think more broadly about how you can engage and help your clients through that. But also with COVID, we have people that need help that maybe they're concerned about getting sick. Maybe you're one of them that is concerned about getting sick. You know, in many states, the virus is spreading, and that's kind of a problem, of course. So as a provider, I like that I have a home office and I have very little exposure. So I think that's a way to think about that. And this slide, interesting, didn't expect that. So, so another way to think about helping clients with technology before we get into the nitty gritties of a session is that clients need a lot of reassurance, as you guys know, and apps can help them with that loneliness. The video can help with that connection. They can help with reminders and just engagement in general. And so as you're thinking about you're setting up what you're going to do or enhancing what you do, think of it step by step as the client. You can start thinking about a roadmap and kind of a decision tree of, how will they get these different things from you, how you get them from them, and is it a good experience? So it needs to be both good for the client and for the provider for it to be a workable solution. And if you have other systems in place, like a biller, you need that to go fluidly for yourself and for other people involved in billing and scheduling, that sort of thing. So there are lots of technologies on the market that do these and can solve kind of practice management headaches, but also think about it from the client's perspective. What would they need in between sessions? And that's something that we haven't talked about as a field, is how to help them in between sessions. And again, the technology can do that without putting a lot of burden on the provider, because I know a lot of us don't have that, still have a fee for service practice, and we want to get paid for that encounter. So you can actually charge for those encounters, or if you're in a capitated environment, this actually reduces the cost of care if you can do more engagement to keep them on track with their goals. There are some services out there that you may not be aware of, like chronic care management. These are billable behavioral health services for people that have 2 or more common conditions, where you're able to help them in place asynchronously. For 20 minutes of time asynchronously to help them meet their treatment goals, stay on their medications, stay in independent living, those kinds of things. And you get paid for that. So, and those are good services that really are truly helpful. And they mirror the same chronic care management that's in the medical world, where we have people with heart disease and diabetes and things like that, and we're helping them stay on track with their treatment. This is the parallel in behavioral health. So if you're interested in that, I'd love to talk to you more about that. And there's more resources on our website, of course. But again, it's just an example of thinking more broadly than just the fee for service, the one-on-one counseling. Also, with apps and with video technology, we can do a lot more group work, where groups are talking together and they don't have to travel for a specialized group. So you can have highly specialized groups, 6, 8, 10 of them together, meet on video once a week, every 2 weeks, once a month, and get a lot of engagement. And I've actually been a part of some provider groups where providers are kind of talking about their struggles and getting kind of that peer support and peer encouragement, instead of the isolation that we normally would get by working alone. So there's quite a lot we can do with technology to solve different problems. I guess I want you to think a little bit more broadly about that. And if you have questions, again, we're happy to help lead you to some resources. When you think about actually doing the clinical work directly, some of the apps are not appropriate for sending you medical information because they're not HIPAA secure. There are some that are HIPAA secure that have different components of it. So you can have an app that has video and then secure chat or SMS messaging, text messaging. You can also have different modules for doing like self-help work. CCBT stands for computer assisted cognitive behavioral therapy. So you can have those things, or a library of content where people are kind of getting help and nurturing, and you can assign homework to them in between sessions, so that when you do, or maybe even a worksheet, so when you do meet with them again, you can go over the results and go over their work and talk at a more advanced level. And so with that kind of multifaceted treatment, people can do quick check-ins, they can get encouragement in between sessions, and they can actually go deeper in their work, even though they're doing this through video. So that kind of breaks some of the myths that maybe this isn't as good as in person. I think some ways, if you use a technology in certain ways, it can actually enhance your services quite a bit. So just wanted to put that into your mind that there are lots of different types of services you could do. And I think it's time for us as a field to start thinking about how do we incorporate this more systemically, more regularly. Some of the groups that I'm working with are already doing quite a lot of this already, where they they have combinations of individual work, group work, in between the clients and different cohorts help each other and communicate each other in moderated formats. And then also they have libraries of content that are assigned and worksheets, and they kind of go through kind of PACE programs to get better. And the outcomes are really, really good. So we can do that on an individual basis. We can do that on a kind of a group programmatic basis. It's really up to the limits of our creativity, because the software is already available, and you just need to create the protocols to go along with it. So I just want to encourage you all to kind of think outside the box, think outside the session, and how can you enhance your sessions to be kind of more full, if you will. And in my work as a counselor, I do quite a lot of worksheets, and I like to have kind of push my patients a little bit, my clients a little bit to do more work. And then we go over the results of what they filled out, and that creates kind of a lot of deeper processing than we normally would do. So we're actually able to go into issues a lot more deeply, more quickly, and instead of kind of beating around the bush. So a lot of the modalities are useful for different things. And so as we think about the modalities, just realize that they all have their pluses and their minuses, and there's limits to all of them. So I'm not saying that they're all great for everything. It's certainly not the case. Also, I think these are good in combinations with in-person therapy at some point. So as a provider, I actually prefer in-person therapy, both providing and receiving. But when it's difficult to do that, video is good. I would caution again to not compare video so much with in-person, because a lot of times it's choice not between video and in-person, it's the choice between video and nothing. So at that comparison, it's definitely has high efficacy. But even the research shows that compared to in-person, it does have high efficacy. But again, it's a matter of who the provider is, and if you do good work in person, you can do good work online as well. But each of these components has their kind of pluses and minuses, so just think through that as you go along and use the right tool for the right job. One example that I like to point out is my very first app that I made was for insomnia. And that's kind of what inspired me to help create more apps over time. And we found that, actually CCBT is the gold standard, or CBT is a gold standard for insomnia treatment. And so an insurance company hired us to create an app to help people get off of Ambien. And it was chosen by MIT Harvard work group as a treatment of choice, and then used all throughout Harvard and Partners Health. So this is what inspired me to do this. And there are many other things that we could be doing. And what this specific program was a self-paced program where they learned a lot about sleep hygiene and what causes insomnia and how to help themselves. And then we had actually a live chat to help them use the information and tweak that to their own personal use. And then in a later version, we had video sessions to work on some of the treatment parts where they had a lot of anxiety and depression that was part of that, or substance abuse. That was part of that whole profile. So again, it's not one tool fits everything, but using the right tool for the right condition can certainly be very helpful. I already mentioned chronic care in behavioral health. So I think that's, again, something to be thinking about. If you are part of a larger system, how to implement that in a systemic way. This is in addition to the normal billings that you would do for your other services. So this is a whole other line of business. So if you're looking for revenue streams, this is an additional revenue stream, and it's good filler for when there are no shows. They can kind of do that. And that sounds kind of crass, but from an operations standpoint, it's good to have work to be done when nobody showed up for your clinic, and still know that you're going to meet your budget and pay your clinicians so that you continue to do the good work you do. So it kind of all balances out. But it's a win-win, because the clients get a lot more care in between sessions that you normally wouldn't get. And it really helps them stay on track with their treatment goals. So highly recommend looking into that. Again, you can use video, text, CCBT. This can all be part of one systemic approach to doing care. But we wanted to drill down after talking through apps. We want to talk about a little bit in a moment about what we do for just the individual video session. So I'm going to spend a little bit more time drilling into that. But this is just a little mock-up of when you're looking to make a program. You can think about many different types of help, and this can be in a HIPAA secure app for you. One recent one we did was alcohol and drug relapse prevention. Another one we did was MAT, looking for remote MAT providers. So how do you get MAT when you travel? And we created a treatment locator for that. So again, one size doesn't fit all in tools and technology, and it's good to think through what would actually help, and then is there technology out there that can meet that in a secure way? So again, this is just examples of those things I was just talking about. But the biggest hurdle to most of this is HIPAA security. And so I want to just address that a moment here. HIPAA security, if I just dial that back for a moment, there are quite a lot of considerations. And if you haven't looked into HIPAA, it's time to look into HIPAA. I remember implementing this in the 90s, and we were afraid that the HIPAA police would show up at any minute. They didn't, and we were thankful. But now there are quite a few that are getting fined for that. In the COVID era, they have not done away with HIPAA, but they have asked that everybody abide by HIPAA, but they're not going to be going after and enforcing HIPAA for this emergency period. However, enforcement of HIPAA is not the thing I think you should be worried about. I think you should be worried about a breach, which is potential for a lawsuit from your clients or your patients. Because even worse than the lawsuit would just be a breach of confidentiality, that the private health information, private treatment, mental health treatment information leak out about your clients. So it's really imperative on us, it's ethical, legal duty for us as providers to make sure we're protecting the information of our mental health, behavioral health clients. So while there's a little bit of laxing of enforcement of that, the government's still expecting you to abide by HIPAA. They actually specifically say you should use HIPAA secure technology. And then the other times they're saying if it's an emergency and you can't get to that, you can use these other means. But by and large, they're asking you to use HIPAA secure technology, and I'll go into a little bit more of why. But it's important to realize that HIPAA is not a one and done thing. It's a combination of administrative policies and procedures that you do in your practice, as well as technology, as well as your physical things. So I can talk quite literally for at least a day, maybe more, about all the bad things that can happen to you. In my case, I had a 12-year-old that hacked our school district, and he could break into your router, into your computer, and take all your data if he was interested in that, because 12-year-olds have fickle attention sometimes. So it's the capabilities are out there, but what's worse than an actual hacker is that some of the hackers now create bots or spiders or robots that scour the internet looking for internet vulnerabilities. So if you have a WordPress site, that's the most hacked site on the planet, type of software on the planet. They are looking for vulnerabilities in your WordPress to see if they can break into it and steal that data. And some of them will break in and mess up your site. Some of them will just break in and take the data. Medical records go from between $10 and $50 each on the black market. So they're highly valuable to have a backdoor into somebody's software and steal stuff. When you have a website, your contact information page, when people are putting in information on there, that becomes HIPAA compliant data, or PHI, protected health information. So that page itself needs to be protected on a secure site. So it needs to be HIPAA secure, meaning there needs to be a business associate agreement with the hosting vendor. It needs to be protected in multiple ways, and it's beyond the scope of this. But that's real important that you know that your email, if you're emailing clients, I would recommend not emailing them because while you might get permission for scheduling and things like that, they're not going to be happy if there's a breach of their entire private health information. It's easy to get sloppy on email. So I would recommend using HIPAA secure software. There are many vendors out there that have this very inexpensively, between $20 and $50 a month. You can get a system that has scheduling and document sharing and messaging to have a very secure system, very streamlined approach. I'm saying that, as a vendor myself, but also just to advocate for protecting yourself and making your life easier. So I would recommend doing that, but also you need to look at the administrative part of this. So you need policies and procedures that are protecting you and protecting a client. So that you need to have plans on how you're going to give access to that data, how you could protect it. Also, if there's a breach, what will you do? Will you ever notice a breach? Do you have monitoring in place for that? And then what's your disaster recovery? If something happened to your data, can you get all your records back? Do you have a disaster recovery plan for that? HIPAA compliance, again, it's important for a number of reasons, but another one is your referral sources. They're going to want you to be HIPAA secure so that you're not putting them at risk legally. So they want to know that you're doing the right things to stay secure, so that when they refer patients to you, or you refer them to them, that it's not going to be something that's going to be harmful to them. So just consider that. So just think about those different things. I know it's a lot of information right now, and there's a lot more on the MATRC website. And we do other presentations on HIPAA security to do that. Also, the privacy rules apply to telemental health just like they do to a website. So the privacy policies are basically telling the patients what you do to secure your data. And if you're going to sell your data or not, you're allowed Facebook or somebody like that to have access to that data. And that's the kind of thing that you just need to tell them who accesses your data, their data, and how are you protecting it. And then also you need to be doing your own risk assessment for all of your systems, everywhere you have protected health information. Where is it, who can access it, and how do you protect it? Those are kind of the big high level questions. And that's different for everybody. This is why it's hard to say, give me a template for that, because people want a template to make it easy, and I'm happy to give out templates, but templates have to be tailored to every single individual practice, because every practice has different use cases, different technologies, different workflows. So just keep that in mind. It's not a one size fits all. Some examples of PHI include the first name, last name, the email address, social security number, phone number. I think I said email address, their IP address on their internet, sorry. And that's basically the location of where they physically are on the internet, what server they use or hosting they use. Those things, their MAC address of their computer, those are individual identifiers that can identify that person. And so if those are things that are zip code, those are things that are protected health information that a lot of technology vendors access and collect. And it's okay that they access them and collect them. They just need to protect them as if they're a medical record, because they are considered a medical record. Because people can put those pieces of information together and identify somebody as a mental health client. I mean, that would be kind of bad news for that client. So just, again, it's okay that the vendors collect these, just make sure that you have a business associate agreement with them that says that they're going to protect that, and they're legally bound by law to do that. So make sure you read those agreements when they come by. There's also some security rules, and again, I want to go into a lot of that, but how you secure your data is very, very important, and who's in charge of securing that. You need to have somebody on staff that's a designated privacy officer to do that, and should get some training. All your staff should get training in HIPAA over time. And then you want to also know that you as a covered entity are abiding by the encryption standards. They keep getting updated. And you need to be somebody in your company needs to be up on that, or at least contract with some company that's up on that for you. So in a direct-to-consumer realm, I use this slide to kind of show these workflows that you usually start from, low compliance or no compliance, and you work yourself up over time to be compliant. So it may be a little bit overwhelming at this point. Just think of making a roadmap to go from here to there. Start with a risk assessment to identify where your needs are, fill in those holes, or make a plan to fill in those holes. So if anything happens, you can say, hey, I have a plan, I'm trying to work on it, I'm not just negligent. there's a set of fines in HIPAA that when they do start enforcing it, one of them's called "I did not know," and one is willful negligence, so knowing and not doing anything about it. There are lots of things like that that we need to wake up to. But since we're getting into telehealth now, it's time to kind of upgrade all your technology and your standards, your security, so you can feel very safe doing this. Your clients can feel safe doing this. Whether or not you're doing video telehealth, this is something that you should be doing. The laws, just to switch horses here, the laws are different in every state for every profession. This is just a sample of some of these differences. This is from a study I did in 2015, and actually the map is worse now. So in 2015, the gray states showed you where there were no laws, no regulations on telemental health or telebehavioral health. The green states showed you where there were telemental health for counseling, psychology, and social work. And the purple states just showed that 2 of those had something. Yellow showed social work only, purple showed, orange showed counseling only, and blue showed psychology only had something in the books. Now there's quite a lot more out there, but the problem, as you'll find, is when you Google the laws, it's hard to know what to Google because they don't use the word telemental health. They do about 1/3 of the time. The other 2/3, they may use electronically assisted care or digital health care or distance counseling or something like that. So you need to contact your licensure board and ask them what do you use, or you can contact me. What is the language that you use, and how do I find it? Because sometimes it could be by a different department and not necessarily the licensure board that put out guidance on what laws to abide by in your state. So it's different in every state for every profession. So that's the rub here. One thing to know about the laws, what is consistent is that every jurisdiction, which is in the legal boundaries, every state looks at it like the encounter has happened in the jurisdiction of where the patient is located at the time of service. So wherever the patient's located at the time of service is where the laws apply. So we had on our last session somebody asking about New Hampshire. My client's in New Hampshire, but I'm in Massachusetts. Well, then New Hampshire would be the laws that apply. There are some states that will allow cross state lines, and we have some of that information on our website. There's like 17 states, I think, that are through this emergency saying, if you're licensed in another state in good standing, you can practice in our state during this emergency. So you just need to contact that licensure board and let them know that you're doing that. Because there are a lot of people that are stuck in the wrong jurisdiction, right? If they went home from college, but they're normally in college and seeing you at college, that's a jurisdiction issue likely in that time. So I think you can work those issues out. If you can't work those issues out, just simply refer to another online counselor or another person in their state. And there are other people in other states doing this work. So we don't like to refer out, but that is the appropriate thing to do. To be legal and ethical and be a good role model for your clients. So in our last 15 or so minutes here, I want to go through some of the best practices and help you kind of talk you through how to go about doing that and then what to do in your first session. So as part of creating the board certification in telemental health a few years ago, I aggregated all the laws in all the states for 8 professions. Or I did that for 3 professions. Later on, I did it for 8 professions. And then we collected 11 ethics practices and then all the literature to find out what's truly the best practice across the board, every state, every profession. And this is the list that we came up with. So by abiding by this list, you're going to abide by, 95% of states and 95% of the laws in all those states. So this is going to keep you safe. Now, every state, again, might have a little bit of nuance in there. They might say, we also need you to get this or that piece of information. But this is, again, the majority of what you would need to do no matter what the state is. But do contact your state. So the first thing you need is training. This is a good introduction, but you're going to need more than this because there's a lot of nuances with this practice. And I don't think you need like 40 hours of training. I think you need maybe 4 to 6. And it doesn't have to happen all at once. It could be even asynchronous. But what that will do is that'll help you prepare for when things go wrong and how to prepare to make things go right. It's going to cover your paperwork and things like that, disaster and things like that. I'm going to go over some of the highlights here, but I would recommend getting more training. There's some of this online, and we can provide it in different ways. Just so you can search on our website and find a lot more. Um, so training is legal and ethical issue. You do need to get training. A lot of this, we're thrown into this because of emergency, which is acceptable, right? But doesn't mean that we stay ignorant. It means we get training to get better at this. And again, you're going to feel more confident, more fluid, better at doing all of this. The second thing is abide by your association and credentialing body ethics. A lot of times the regulations will say, and abide by your ethics, which is a whole different set of things that you need to do. Again, a lot of it's included here. So I think you'll be in good shape, but you do need to look at what your ethics are, and I can help you get those if you need that. The third thing is data security. So basically this kind of goes back to that HIPAA part where you are ensuring to your client, and you're telling your client that you're securing their data, and you're not allowing someone to have a breach or leak their data out. You're keeping the confidential records. Now, all of us were trained that we have to keep our clients' records confidential, but with the ease of technology, it's really easy to ignore that. So it's kind of like putting the keys to the file cabinet on top of the file cabinet and walking away. We would never do that, but with technology, we feel like it's magic and it's never going to get hacked, or there'll never be a breach. But it can, and it happens quite often. And you guys have seen the headlines where that's happened to even big medical centers. So you do need to do a little bit of homework, and you need to do a little bit of digging and get a little education on what is considered secure. How do you know how to find secure technology? That's stuff that's on our website, matrc.org. There's a Telebehavioral Health Center of Excellence site, and it has a lot of data on how to select things, a lot of tools. We have a comparison site where you can select by criteria to find those kind of providers that are doing a lot of security, because one size does not fit all. When you find a provider that says HIPAA compliant, they just mean that they're doing something about HIPAA compliance. It might be just a little bit of encryption where the other parts have big holes in them. So you need to understand that it's a lot more than encryption and a business associate agreement. It takes a lot more than that to protect the data. So again, do some of that work that you need to be displaying your provider credentials. That just means on a website somewhere, you have your name, your address, and whatever a way to verify your license number. A lot of times there's a license lookup link with the licensure board where you can click a link and find you to verify you're legitimate. That's good for our profession. That just protects us to say that other Yahoos can't say that they're a professional when they're not. So it's actually good for our profession to have that displayed. So they know you really are who you say you are. And then you also need a telemental health specific informed consent. So informed consent, as you guys know, is a lot like the labels on the back of a medicine bottle that talk about all the horrible things that can happen, and that they're agreeing not to be liable for all that, or you're not going to be liable for that. For telemental health, there are some things that can happen, and we need to be very clear with them. And it sounds kind of ridiculous to say that you're not going to be able to help them in person if there's a crisis, but you got to say you can't help them in person if there's a crisis. That's the kind of thing that just needs to be very spelled out clearly. They need to know that there's the possibility there could be a disconnection. So a telemental health specific informed consent, and there are about 10 or 12 things that I would include in that. We have some samples again on the Matrix website, matrc.org website. So again, your normal consent may not be enough if you don't have those things in there. You could just add it to your normal consent, make it a little bit longer, and then you got a one and done for everybody, no matter whether they're telehealth or not telehealth. And that's kind of what I would recommend at some point. But you do need to make sure that they have informed consent. Also, remember that informed consent is a fluid thing. So anytime you're doing anything new, you need to be informing your client, we're doing something a little different. I need to inform you here the possibilities so that they have informed consent. So anytime you're using an app, anytime you're doing a different technique, know that informed consent is something that you should be doing on an ongoing basis with your client. So that, just keep that in mind. Privacy protection is also part of that informed consent process, telling them how you will use their data. And that's also part of that HIPAA security part. These kind of things go together, where you're really looking at where does all this data go, who actually has access to it, when do they have access to it, when's it taken away. So they have a right to know where their data is going. and who can access it. And you should be abiding by a principle called minimal use, which is a HIPAA policy that's required by law to say that only people that have a need to access that information are accessing that information. So if you're, again, a vendor or someone like that, should not be poking around your records, looking at things that are not part of their job. Same with your administrative staff or whoever else is in your practice. But you're supposed to be monitoring that, and that's part of having good systems in place to do that. So that privacy protection, they need to know that you're keeping it confidential and private also. So the next one is alternative means. And what that really means to me, the way I provide alternative means of communication, it sounds really big and fancy. It just means a cell phone to me, or some other phone number. So if I'm doing a session and the internet cuts out or electricity goes out and suddenly they disappear, or I disappear to them, they need a way to contact me immediately. And that's what that's for. So kind of case an emergency, they can pick up the phone, they can just call me and get right back on. A lot of times I just have them click the same link that they used and it starts right back up. Or if not, then they have a way to get me. You need to be careful that if you have a voice over IP, that they're not, that's not disrupted because you're using the internet. So if your internet fails and your phone number was based on the internet, you're in trouble. So you do need some way to connect with them, them connect with you. I usually, in my practice, I'll have the patient's phone number or the client's phone number, and they'll have my cell phone also. And it's not my personal cell phone, it's just my work cell phone. And they know that I keep it off, and there's a way to contact emergency numbers outside my session, but during session, that's available for them if they ever need it. And I've had a couple sessions where their computer died or something like that, didn't power up, they don't have a cable, and they've called me on that, and we continued our work. So stuff happens, and a lot of this is kind of preventing that stuff from happening and being prepared in case it happens, because it does happen. So the next one is jurisdiction. As we mentioned before, jurisdiction is where the patient is located at the time of session, and that's different for every state and every profession. So you need to contact that licensure board to make sure that you can practice in their state. And again, we've gone that. We could go a lot more depth into that. So if you have specific questions, please look on the website or contact us individually. We can definitely help you. Access client suitability to the venue. So So for whatever you're doing, you need to make sure this is really appropriate for this person. So if they're really tech phobic or they're really ignorant and really uncertain of how to do this, that's a client that you need to walk through and really handhold to make sure they can do this. And if you have administrative staff, that's a great use of that staff to make sure they do a little test call, make sure that's appropriate. If they can't do that, then we don't want to force or push that onto them. But in terms of clinical research, we found that the entire DSM spectrum is available to see through telebehavioral health to the video venue. But if we're advising them to do certain things, we want to make sure they have the abilities to do that. It's kind of like asking them to fill in a worksheet. If they're not literate, that's not appropriate, right? So we just need to make sure they have some computer literacy to do these computer assisted things as well. So a lot of times the suitability is really more about the provider, because if the provider is not, if you're not trained in working with alcoholics and have experience, you're going to be really uneasy seeing someone that's drunk on a call. So, but someone that's a seasoned addictions therapist will I've had a couple tell me, if I waited till everybody was sober, I would never have any clients. So I don't mean to be coy or be demeaning. That's just kind of the reality is they have to deal with a lot of people that are intoxicated or high on something while they're doing treatment. And that's, but they're used to doing that. And so someone that's not used to doing that, that wouldn't be suitable unless they were doing that under supervision. Also, we want to look at their safety in their environment. And really, the environment is for both of you. So if you're at home, you need to make sure that you have a clinical environment. I have this wonderful bookshelf back here that's not really here. But I have a private place where there are no interruptions, no pets around. It's very clear. Nobody can overhear me in my space because I made this a clinically sound place. Your clients, before their session, you want to talk to them about making it a clinically appropriate space too. That's tricky because in this COVID area, they may have kids at home, they may not, or extended family member at home, they can't, or a spouse, they can't really do that. I've had clients see me in their bathroom with the fan on, or in their garage with their car, in their car, because it's the only soundproof place they could find to do a session. Sometimes they just have to be cryptic because they don't have an option. So just keep in mind that that's something that you need to think about. Is it psychologically safe? You want to have an agreement where they're not really allowing somebody else in the room on their end, but they're being mindful to protect their own boundaries and psychological safety. So we could talk a lot more about that, but that's in general what that would mean. At the time of visit, you'll notice on the screen, I've put these in kind of 3 different columns. And so one of them is, here's the concept, and then kind of here's, what to do, and then here's when to implement it. So a lot of these are, this is information I give to them. These are, I'm talking right now about screenings that I give during the first session, actually each session also. So I'm asking them, where are you located today? It's like one of my first questions. I go, hey, how you doing? I don't say, hey, how you doing? I say, hey, where are you located today? And if I recognize the background and I already have their address, I click off a little box that same address. If it's a new address, I actually write down the new address. Because if there's a crisis, I need to send emergency services to that location. And so it's really important that before the session starts, I get that information. Now you can get that as a form before they log in. You can get that live. You can have an administrative person get that. But in general, they need to know that when they change locations, you need advance notice of that. The second part you need that kind of goes along with that is you need to have access to, it's number 14 down there. You need to access or identify, emergency services near that client. So if I'm in Charlotte, North Carolina, like I'm today, and my client is across the state and I call 911, I won't get Durham 911, I'll get Charlotte 911, and they can only help me in Charlotte area. So 911 is very specific to your location, and you need to be sure that you have a number of local emergency services there. And there's some tips and tricks we can give you on how to get that more efficiently. But know that that's required, because if there's an emergency, they're not really either able or willing to help you if they're psychotic or suicidal. So that's why you need to be prepared for that in advance. Also, you need to do this, you need to know who they are. So imagine calling the sheriff's department or a hospital saying, I need you to go check on somebody, and they're going to ask their name, right? And you don't know their name and you have a professional relationship with them. That's kind of bad news. Now, for the most part, most people are using some kind of credit card to get payment. But I would just let everybody know that it's not considered ethical or legal to see people anonymously through video. So we need to, or through any electronic means, we need to have a clinical professional relationship with them where we do have their actual name and number. And then it's imperative to us to keep that private, right? So just know that some people are trying to go that route, and we really strongly urge you not to. Also, you need to know their age. So if they're kind of iffy on their age, I no longer get carded at the grocery store buying beer and wine because of my gray hair, but if we need to know that they're old enough to sign a contract with you. So if they're iffy, and what I do about identity is I just simply have them show their driver's license or some kind of government issued ID, and I take a screenshot of that and I save that in our clinical records. So I know who they are, where they're located, what their age is, all that is there. So when I'm seeing them later on, if I haven't seen them in a while, I can do identity verification. Some people, if you're not, you need to have not just the visual, but if you're not doing, let's pretend that you're having a session and they say my video doesn't work and my audio doesn't work, so let's just chat back and forth. It could be their abusive husband or boyfriend or something like that. So, or somebody impersonating them. So it's always good to have a kind of a password that you set up at the beginning. They can give you what that is so that nobody else knows what it is, but you put it in your clinical records and you can just ask them the password. Or you can ask them a question that only they would know, so that somebody can't impersonate them online if you don't have video and audio. The last couple things are kind of they seem ordinary and normal, but it's again, having emergency contact would not just be their mother in Seattle. It would be somebody local to them that can actually go be with them if there is an emergency. So you're looking, you're looking to shore up that help for them at that time, and that was my alarm telling me to hurry up. So, and then the last one's actually the trickiest, is that's providing viable referrals. And because of that, because we're doing this online, it's tricky to give them on viable referrals. So know that that's kind of a quandary no one's quite cracked. The reason they're seeing you on video is because they don't have viable referrals, but we're supposed to give it the college try. So I have more slides here that I'm just going to quickly zip through because I want you to be aware of them. They got some good information, but we're not going to have time to go through it. So this is kind of a sequence of things I would do if I were going through a new session. You know, new or established patient, and some of this is redundant. I would do your testing before your setup to make sure that everything is good to go before your sessions for both of you. And so this is just going to give you some of that technical preparation checklist stuff that you can go over before your session with the client. So you can come get the slides from our app, and this will give you kind of a good checklist to look at. Know that we have a lot of different things that can go wrong. This is my favorite FBI informant pose. That you like that, Danielle? So this is your FBI informant. This is how we look when you have the light behind us. And you're going to need to ask your client to make those audio video adjustments. So you want to look professional, act professional, because this is your credibility on the line. If you're multitasking or you're typing and your keyboard is doing this number, it's not a great experience for the client. So it's good to do some practice sessions with whatever you're going to be doing. Turn all your alarms off so you're not distracted. And then make sure you have good eye contact and posture, or you're going to get back problems like me. And one way to fake eye contact, again, is put the camera, the picture of Danielle is right under my camera, so it looks like I'm looking right at her. So again, make sure your background, you look professional, and you practice doing all these things. I'm gonna reference you some quick resources. If you go to the Matrix site or the NETRC site also, they have tons of resources. We have tons of resources. We have to connect with each other because there's so much stuff we have for you. But we really want you to feel very supported in this, because we know it's a lot of information and it's a lot of insecurity up front. So we have these checklists and things for you. We also have consultative, we can chat with you or have a video call and walk through things with you and help you answer specific questions if we have it. On the MATRC website, we made a COVID page. So like everything COVID is here. There's a big long section on telebehavioral health also. Another training session that goes over a lot of these highlights is also here for you. And then the comparison site is actually embedded in the Matrix site to help you shop for software. So I'm going to turn it back over to Danielle and let her finish up, and we're going to start taking some Q&A stuff here as well.
So Jay, I know something that always is helpful to know for folks, and having all of the sort of tools at your disposal when you're doing consults with, you know, the forms and doing some of the screenings ahead of time, so that you've got that taken care of and you can look at it as part of the patient history and see what's going on with them. And we've been having a couple of questions lately about consent forms and what's the easiest way to kind of embed them, because we're doing e-consents right now, because where everybody's at home. So do you want to talk a little bit about that?
Sure. If you have a patient portal, that's obviously the easiest way. There are inexpensive softwares out there where you can actually get the patient signature so they can see a form, sign it. So there are multiple ways to do that. So if you're not familiar with that, you can contact us and we can give you, 2 or 3 options to do that. So that's a good way to get the actual signature. There's digital signatures are legal, but some people don't like that. Some lawyers don't like that. So your legal counsel may say no. Some people say yes. So we try to offer both, of course, but we'll give you some options for that. But that's it's necessary for every consult that you do. Not every consult, but your first consult for every new patient. So.
Right. Per your standard of care, right? If you're doing annual consents, and then like you mentioned, if you're changing something up, then to make sure that they're consenting to that as well. So great.
Yes. So the COVID thing won't excuse you from not doing your standard of care. Right. So that's something that we need to just be very clear about. And there are tools and resources out there. So if you're having trouble, just contact one of us and we'll lead you to some resources.
Mm-hmm. So on Kenneth actually comments, one of the struggles I've run into is patients who don't have access to the internet. So getting that e-consent is a struggle for him.
Yeah, and that is,
This has a question. What's the best practice regarding virtual backgrounds when you're seeing clients?
So best practice is professionalism. So whatever that means for you is might be different. A casual background. Obviously, I like kind of an office feel to it. Actually, University of Arizona did a study that there's actually a perfect color, which I think is robin's egg blue. It's kind of like the blue of my shirt. But honestly, it's just having a video background that's not a distraction. Because the main focus is that the patient has a good experience, the client has a good experience. So you don't want a cluttered background or something that's to distract from getting the work done. So remember, that's the main point here, is to help the client. So whatever's going to help them. If it was a kid, I'd probably put a Minecraft background or something like that in the background, because they would, honestly have more of a connection with me at that. So I wouldn't wear a jacket. I would, be more casual. So it's really just matching your audience. But that's a good question, and there are probably going to be some research studies out of this whole thing soon.
Absolutely. We have speech language pathologists that we've worked with that actually have the families send pictures, and they put those in the background, and they really engage the families in the therapy. But so we have 2 super quick questions left, and then I think we're out of time. Ellen asks, hopefully a quick question, do you suggest doing the password security question as a standard? We are still doing a lot of audio only therapy.
Yeah, I do think it's a good standard, and I include it in my practice. I think it's a preparation for something that will happen rarely. But when that rare thing happens, it's kind of a crisis for the provider to know, is this really the right person or not? And could lead to lots of legal problems. So I think it's a good standard. You only need it when those rare times happen, but I think it's easy to do that. Or you could have something in your consent form that's very private, that only that person would know, not their spouse or not their parent or whatever. And so that piece of information could be an identifier, but you're looking to basically, what's a unique identifier that only the patient would know?
Sure.
And that could be, you have some item that this is a purple cow, and so just remember this in the future. If I ever ask you the color of my cow, what would you know?
Right. And I know in this day and age, right, where we have tons of passwords and so that are easily
something memorable, right?
Exactly. Rishu, one more question for Jay, and then we'll have to kind of wrap up. I've unmuted you.
Thank you so much, Danielle. Jay, I have a quick question related to something you talked about earlier. You were saying that you use these worksheets to do sort of like a self-CBT or like reflection thing for a lot of your patients when you're counseling them. Mm-hmm. So to give a little background, I'm trying to create a messaging service for opiate addiction patients who are in MAT, to do something similar to give a little bit more information to their counselors when they come into the next check-in. And they do this via text message to lower any barriers for downloading an app, or to try to improve engagement. But I've noticed some like very terrible engagement rates. People aren't very likely to fill out these surveys. It's a lot of extra work. I was wondering if you had any personal experiences to share around that, about how you approach these types of problems with engagement.
Yeah, we just made one for this Australian government, doing a very similar thing. And I'd be happy to talk to you more if you want to contact us through the Matrix website, where we broke it up into component parts, smaller chunks. Also, there's a higher engagement when there's an authority figure, if you will, a provider saying, "I need you to fill this out," or "Please fill this out and let's review it together." It's kind of the approach is more of the motivational interviewing, if you will. So those kind of techniques are highly effective, but don't do a long survey in the beginning. You want just little chunks. You want to do just-in-time information right before and kind of iterations throughout. So I know it's not all the data they want up front, but it's the data that they're going to get a higher return rate for. And again, who asks for it is going to be a big difference. But I know people want to programmatically do this, but person just actually asking is going to increase the rate dramatically.
Thank you so much. If you're available, I'd love to follow up on that a little bit more and pick your brain if I can.
Yeah, I sounds like you two need to connect.
This is what's fun for me. So we'll have fun, Rashid.
Awesome. Well, we truly are out of time now, guys. I want to thank you all for joining us, and thank you so much again, Jay, for sharing your time and expertise with us today and lots of other times throughout the year. We so appreciate it. Just as a quick reminder, please fill out your session evaluation within the tab, because we so value, we want to know, what you appreciated, what's helpful to you, and then how we can continue to improve these sessions moving forward. So thank you all. Have an awesome weekend. Just a reminder, we're off next Friday because we aren't thinking anybody would show up on July 3rd, but we're right back here on July 10 and July 17. So we'll see you then, and have a great holiday weekend next week.
Thank
Bye
you.
all.
Everybody.